Welcome back to the news wrap. AstraZeneca will reportedly restart its U.S. vaccine trial very soon, but hours later, we're learning a volunteer in its study in Brazil died. Meanwhile, Pfizer reportedly gearing up to distribute its vaccine candidate ahead of FDA approval. So, where does the vaccine timeline stand as new COVID 19 cases continue to rise in the U.S.? Well, here to break it all down is Dr. Daniel B. Fagbuyi, Obama Administration Public Health Biodefense expert an emergency physician in Washington, D.C. Thank you so much for joining us. I want to start by asking you about that AstraZeneca news. So, as we mentioned, a volunteer dying in the Brazil trial there, but now the U.S. trial in limbo. What do you make of all of this?
Yeah, thanks for having me. It's just one of those things where we just have to evaluate what's going on and take it based on the information that we have in hand. You have to kind of reflect on that. So there's a clinical trial that's going on. There's a patient who dies. Remember, in the clinical trial, there are actually two arms. There's one arm that's actually getting the real deal, the vaccine, and there's another arm that's getting a placebo or control. We don't know what it is, maybe saline water. Okay. So with that, we don't know which arm this patient is. There's nothing revealed. At least we don't have that information. So for them to actually have said that they're going to continue with the study trial, it makes me say, probably this is a patient who didn't receive the vaccine. Because if the patient had received the vaccine, you would assume they would have stopped it and paused it, at least do some more investigation. So that bodes well, at least in my preliminary evaluation of the information that we have. And of course, this is a dynamic of change. So based on what we have, that's what I can assume.
So interesting. I'm glad that you were able to clarify that. But I also want to talk about Pfizer, another company that's entering late stage trials in the US. The Wall
Mhm.
Street Journal just reporting that the company is preparing to ship billions of its COVID vaccines in preparation for FDA approval. So, are you optimistic about this timeline? How do you feel about it?
I think the timeline is still it's a moving target. It's a lot of things have to still go right. They're making moves. They, as in Pfizer, are making moves, and they've been making moves since March of this year, trying to pre-position themselves. Remember, the logistics that goes into this whole process is tedious. It is. I mean, everything has to. It's an orchestration, and you really have to balance everything. So many things: the dry ice, the shipping, the movements, how it's distributed, where does it go to, all those things have to be done deftly and with alacrity. With all that said, yeah, they may meet their timeline. I think at the end of the year, they probably will get approval, assuming all the safety data is in. But again, my perspective on when am I receiving the vaccine or someone I would recommend to my family member, I have to see all the data. So they can get approved, but that approval is also an EUA, an emergency use authorization. That does not mean the vaccine is totally approved. It means, hey, you can go ahead forward based on what we have here. But full approval is another foot to accomplish.
I think that's a great thing to keep in mind for people. But when it comes to these late stage trials and the four companies that have made it there in the US, is there one particular company that you're especially hopeful about or has a timeline that you think people should be looking at?
I mean, I think they'll mean so the two quote unquote sexy vaccines, the Pfizer BioNTech vaccine and the vaccine, the Moderna vaccine, are the ones that people are kind of. It's the new mRNA type vaccine. It's never been approved by the FDA before, so this is interesting. Some people feel a little bit ambivalent about the fact that they may be getting some genetic material introduced into their body, to their cells, and where now it makes their cells incorporated into their cells, and now it has to now make antibodies to this antigen. Very interesting. So I think it's a bit of a challenge for some people, at least. They've thought about it that way, but that notwithstanding, I'm hopeful for all vaccines as long as we have the great data. But I'm not excited. I really don't want to see this pandemic situation, to be perfectly candid, but here we are. So we have to figure out what's best for the American public, and we have to make sure the data and safety and it's effective. So those are the things that need to happen first before I jump on anybody's bandwagon.
Sure. And speaking of safety, the FDA is going to be meeting tomorrow to discuss emergency use authorization of these vaccines. So, what do you expect to come out of these meetings? Why is it especially important right now?
So, whatever their guidance is, it has to really be rooted in the science. We have to have the data. Now, remember the fact that the FDA has now put a good, solid, stringent guideline in terms of after the last vaccine in the trial has been done, that they actually have to observe for safety and adverse effects that may occur actually 2 months after that last dose was given. And actually, maybe 50% of the patients who were in that trial, at least for 2 months, they watched them over that period of time. So that puts the timeline by around December-ish for any true approval before they can start to possibly inject into people's arm. And it's not going to be just the people that you're really thinking. It's going to be, and I've kind of put this out there on Twitter also, that the people who are going to get vaccines are the priority population, the elderly who are at high risk, those with underlying medical condition, and of course us as healthcare workers. But it's still a process. I think everything will really the system will be lubed, and the supply chain will be lubed better starting next year, early next year. But it won't be in anybody's real arms until the general public, probably between March and January. That's on my crystal ball predictions that I put out there.
Dr. Daniel B. Fagbuyi, Obama administration public health biodefense expert and emergency physician in Washington, D.C. Thank you so much for stopping by. Really, really appreciate your insight.